Many older adults go to the doctor, hear that their cholesterol numbers look good, and walk out feeling safer than they did before. That reaction makes sense. If the LDL is lower, if the report says the numbers are controlled, if the doctor says things look managed, then most people naturally believe the danger must also be under control. But that is where today's story begins. Because there are seniors who take their statin every evening, keep every follow-up visit, walk every morning, try to eat carefully, and still find out years later that plaque inside the artery wall has kept moving forward anyway. Not in a dramatic way, not in a way that causes instant panic, but quietly, steadily, enough to force one painful question. If my numbers were good all this time, why was the plaque still growing? Today, we are going to talk about something many older adults are never given a full explanation about. We are going to talk about the difference between managing a cholesterol number and slowing the deeper artery process that leads to plaque, narrowing, instability, and in some cases, a heart attack or stroke. And I want to begin with one simple truth. A better number does not always mean the deeper process has stopped. That does not mean cholesterol numbers do not matter. They do matter. It does not mean medicine does not matter. It can matter a lot. But it does mean that numbers alone may not tell the whole story, and if you only watch the number, you may miss what is happening underneath it. Many older adults go to the doctor, hear that their cholesterol numbers look good, and walk out feeling safer than they did before. That reaction makes sense. If the LDL is lower, if the report says the numbers are controlled, if the doctor says things look managed, then most people naturally believe the danger must also be under control. But that is where today's story begins. Because there are seniors who take their statin every evening, keep every follow-up visit, walk every morning, try to eat carefully, and still find out years later that plaque inside the artery wall has kept moving forward anyway. Not in a dramatic way, not in a way that causes instant panic, but quietly, steadily, enough to force one painful question. If my numbers were good all this time, why was the plaque still growing? Today, we are going to talk about something many older adults are never given a full explanation about. We are going to talk about the difference between managing a cholesterol number and slowing the deeper artery process that leads to plaque, narrowing, instability, and in some cases a heart attack or stroke. And I want to begin with one simple truth. A better number does not always mean the deeper process has stopped. That does not mean cholesterol numbers do not matter. They do matter. It does not mean medicine does not matter. It can matter a lot. But it does mean that numbers alone may not tell the whole story, and if you only watch the number, you may miss what is happening underneath it. Let me show you what I mean through a story. Imagine a man named Gerald. He is 71 years old. He has been taking his medication every evening for years. He does not skip doses. His wife helps keep the prescription filled before it runs out. There is a routine to it, a small dish on the kitchen counter. Dinner finished, pill taken, one more day of doing the right thing. He also walks in the morning, he watches his meals, he goes to his appointments. Every time his reports come back, he is told that the numbers look good, LDL under control, total cholesterol reasonable, everything sounding managed. So after enough years of hearing the same message, he builds his life around one belief. I am doing what I need to do. I must be staying ahead of this. Then one day, during a routine check, the scan tells a different story. The plaque in his artery has increased. Not suddenly, not dramatically, but steadily. Year after year, it has been growing quietly, even while his cholesterol numbers stayed in what he was told was a safe range. And that is the moment many people begin to feel confused. If the numbers are good, why is the problem still moving forward? This is where we need to understand something very important. Lowering a number is not always the same as stopping a process. And this is the part that many people are never clearly told. Cholesterol itself is not the full problem. The deeper issue begins when cholesterol becomes damaged, when it becomes what we call oxidized. Think of it like this. In its usual form, LDL moves through the bloodstream as part of the body's transport system. But when that particle is exposed to oxidative stress and becomes chemically changed, it behaves very differently. It becomes much more irritating to the artery wall. It becomes more likely to stick, more likely to trigger inflammation, and more likely to start a chain reaction. That chain reaction is what makes this topic so important. Now here is where the body tries to help you. When oxidized LDL enters the artery wall, the immune system sends cells to clean it up. At first, that sounds like a good thing, and it is. Your body is trying to protect you. But if more and more oxidized particles keep arriving, those cleanup cells become overwhelmed. They fill up with fatty material, they lose function, they remain trapped inside the artery wall. These overloaded immune cells are called foam cells, and when many of these foam cells build up, they help form the soft, dangerous center of plaque. So now the story is no longer just about cholesterol floating in the blood. It is about damaged cholesterol entering the wall, immune cells trying to remove it, those cells becoming foam cells, and foam cells slowly building plaque from the inside. This is one reason a person can feel fine, while the artery quietly changes shape over time. And this is also why a simple, "your number is lower," conversation may fail to tell the whole truth. Because plaque is not just a number problem, it is a process problem. Now let me take this one step further. You may have been told that your good cholesterol protects you, and that is true, but only partly, because the protective effect depends on how well it is functioning, not just the number on your report. As we age, that function can weaken. So even if your HDL number looks acceptable, the real-life protective activity may not be as strong as it once was. In simple words, the guard may still be on the job list, but the guard may no longer be working at full strength. That matters because the body needs ways to handle damaged cholesterol before it settles deeper into the artery wall. If that protective system grows weaker with age, the balance can slowly shift in the wrong direction, and this is one of the reasons risk after 60 can look very different from risk at 40. The same report numbers do not always mean the same thing in an older body. Now let us move to the next part, because this is where plaque becomes even more serious. Plaque does not cause its worst damage simply by existing. It becomes most dangerous when it grows unstable. Some plaque can sit in an artery for years without causing an event. It narrows the space, it raises risk, but it does not always rupture right away. The more dangerous situation is when the covering over that plaque becomes thin, weak, and vulnerable. When that happens, the plaque can break open. And when plaque breaks open, the body reacts like there has been an injury. A clot forms. Blood flow can suddenly drop or stop. That is when a heart attack or stroke can happen. So the deeper question is not only, do I have plaque? It is also, what kind of plaque is it becoming? Is it stable, or is it turning into the kind that could break? This is why inflammation matters so much. This is why oxidation matters so much. This is why simply lowering one number does not always calm the whole process. There can still be chemical signals in the artery wall that keep the plaque irritated, active, and fragile. And this is where many people miss the real danger. They assume that no symptoms means no active problem. But hidden artery disease often grows in silence. It does not always warn you early. It often changes slowly, without pain, until the day it suddenly matters. Now I want to pause here and bring this back to real life, because older adults do not sit at home thinking about foam cells and artery walls all day. They think about their actual life. They think about staying independent, staying mobile, staying mentally clear, avoiding the sudden phone call, the ambulance ride, the hospital bed, the rehab weeks, the fear in their spouse's eyes. That is why this topic matters. It is not abstract. It is about whether the process inside the artery is being understood early enough to act wisely. Now, there is another piece many older adults have never heard about, and it helps explain why a normal report can still miss a hidden problem. Standard cholesterol tests are good at telling you the total amount of LDL, HDL, triglycerides, and related values. But they do not always tell you how much of that LDL is oxidized. They do not always tell you how irritated the artery wall is. They do not always tell you how active the plaque process still is. So a person can get a report that says, your LDL is lower now, and that can be true. But at the same time, the artery wall may still be under stress. Oxidation may still be happening. Inflammation may still be present. Plaque may still be evolving. This is why some people feel shocked when the scan and the lab report do not seem to match. This is also why some patients begin asking about more direct ways to look at what is happening. They ask about imaging that looks at artery thickness. They ask whether other markers should be considered. They ask whether the treatment plan is focused only on numbers or on the wider artery environment. And that is a better question, not because the basic lab test is useless, but because it is only one window into the problem. Now let us go deeper into what actually turns ordinary LDL into oxidized LDL in the first place. One major driver is chronic inflammation. Another is blood sugar stress. Another is smoking history, past or present. Another is poor food quality over many years. Another is the natural increase in oxidative stress that tends to come with aging. None of these act alone. They pile on each other. They change the environment inside the blood vessel. They make oxidation easier. They make healing harder. This matters because a person can lower LDL with medicine and still keep feeding the oxidation process through the rest of life's patterns. Again, that does not mean the medicine failed. It means the medicine is handling one layer while other layers still need attention. Now let us come to the part that often creates the biggest moment of confusion for viewers. If the problem is deeper than the number, then what exactly supports the body in slowing that deeper process? This is where food comes into the conversation. There are certain foods that have been studied not just for general health, but for how they may affect oxidation, inflammation, blood vessel function, and plaque-related processes. One fruit in particular has received attention because it appears to interact with several of these pathways at once. That fruit is pomegranate. Now, before anyone runs to the store or decides this is a miracle answer, I want to slow this down and be very careful. I am not saying a fruit replaces medical care. I am not saying a fruit erases years of artery disease overnight. I am not saying anyone should stop prescribed treatment and switch to food experiments. That would be reckless. What I am saying is that this fruit has attracted serious interest because of the way its compounds may support the body in dealing with oxidation and artery injury. And here is where many people make the biggest mistake. They think all pomegranate is the same. It is not. They think sweet bottled juice equals the whole fruit. It does not. They think eating the pretty red part means they have captured the full benefit. Often they have not. Barbara is a useful example because she shows how real life can go wrong even when the intention is good. She hears that pomegranate may help the heart, so she goes to the store, buys bottled juice, and starts drinking a glass every morning. She feels proud of the habit because she believes she is finally doing something helpful for her arteries. But months pass, and at follow-up, nothing clearly improves. Some markers may even look worse because she added a daily sugar load she did not really need. Her intention was good, but the method was weak. That is a pattern we see often after 60. People want to help themselves, but they are given advice that is too vague. It does not explain the real difference between whole and processed, between complete and stripped down, between evidence and marketing. That is why this conversation should feel empowering, not confusing. You do not need a miracle answer. You need clearer distinctions. Now come back to the gut layer, because this part is often left out. Plant compounds do not act alone. The body has to process them. In many cases, gut bacteria help create forms the body can use more effectively. If the gut has been weakened by years of low-fiber eating, repeated antibiotic use, chronic stress, low plant variety, or poor digestive health, then that conversion process may also be weaker. So one person says this fruit helped me, while another says I tried it and saw nothing. That difference may not be about belief, it may be about biology. And that is exactly why health after 60 should never be reduced to one fruit, one pill, one supplement, or one number. The real question is this: what kind of environment is your body working with right now? That is the smarter way to look at it. There is another reason Gerald's story matters. It shows how easy it is to confuse management with protection. If you hear the same reassuring message year after year, your mind naturally relaxes. You stop looking for the second layer. You stop asking whether anything else could still be changing in the background. That is not foolishness. That is normal human behavior. Most people trust the part of the story they hear most often. And for many older adults, the repeated story has been simple. lower LDL, lower risk. But real life is often more layered than that. Oxidation, plaque activity, artery stiffness, and vessel protection may still matter even when the usual report looks better. That is also why this topic can feel frustrating. It is not just about information. It is about whether the information you received was complete enough to guide real decisions. If an older adult lowers one major risk marker but never hears that other processes still matter, that person may do exactly what they were told and still feel blindsided later. That emotional shock matters. It changes how people see their care, their food, and their own body. So to the senior who feels let down by a report that looked better than reality, your confusion is understandable. Your questions make sense. And you are not overreacting by asking for a deeper explanation. In fact, that is the right response. Heart health after 60 is not helped by false comfort. It is helped by clearer context. There is also a practical food lesson here beyond pomegranate itself. Many older adults are used to health advice that praises foods by name instead of by form. We hear that berries are healthy, nuts are healthy, fish is healthy, olive oil is healthy, and fruit is healthy. But form changes everything. Sweetened juice is different from the whole food. Highly processed is different from lightly changed. The label alone does not tell the full story. And if you take that lesson seriously, it improves much more than one artery conversation. It changes how you look at breakfast, snacks, shopping, and convenience choices during the whole week. Now think about the spouse or adult child who may be watching. If you help a parent manage medications, groceries, or appointments, you are in a strong position. You notice routine. You notice what gets bought again and again. You notice what the doctor keeps saying. You notice whether the same lab panel keeps happening while the bigger questions are never raised. That does not mean you should try to become the doctor. It means you can help ask better questions, track patterns, and make sure important details do not get lost between visits. Sometimes the best thing a family member does is write down one thoughtful question before an appointment. That alone can move the visit beyond autopilot. There is also a timing lesson in all of this. Heart disease often develops over years, and that can make people think there is always plenty of time to improve later, but the body does not wait for the perfect moment. The process keeps moving whether we pay attention or not. That is why slow disease requires steady attention. Not panic, not obsession, just steady attention. Better meals more often, less sugar more often, more walking more often, better sleep more often, better questions more often. The body responds to repeated patterns. So does plaque. So does oxidative stress. So does vessel health. That is why any conversation that reduces heart protection to one number or one heroic food leaves too much out. Now let us come to what people can actually bring into their next appointment, because information only becomes useful when it improves the conversation. Instead of asking only, "Is my cholesterol lower?" ask what these results leave out. Ask whether the doctor is concerned about oxidation, inflammation, artery wall change, or plaque progression. Ask whether imaging has shown thickening or change over time. Ask whether your current plan addresses the conditions that help damage cholesterol form in the first place. And if you want to ask about food, do not ask, "Is this fruit magic?" Ask, "Does this fit my situation? Is it safe with my medicines? Does the form matter? Is the juice version actually useful? Or should I think about the whole food differently?" These are the questions that move you from passive patient to informed partner. Now let me say something clearly to the senior who has been told for years that everything is fine as long as LDL stays under control. That message is incomplete. Not always wrong, but incomplete. And incomplete messages often create false peace. They calm people just enough that they stop asking what else may still be active in the background. That is why this topic can feel emotional. It is about trust. It is about the shock of learning that a clean-looking number did not always mean a calm artery wall. It is about realizing that the body may have been telling a deeper story all along. And yet, there is good news in that. Once you understand the deeper story, you are no longer limited to one narrow response. You can still value medication, your doctor, and the lab report. But you also begin to value food quality, oxidative stress, vessel function, movement, sugar control, inflammation, and gut health as part of the same picture. That fuller picture is where wiser protection begins. Now come back to the practical point about pomegranate. If you use it, think whole and think carefully. Do not assume that sweet bottled juice and the whole fruit are the same. Do not assume the most pleasant version is the most useful. And do not use food casually without considering your medicines, sugar levels, digestion, or overall condition. Before we close, let us return to the key question. I did what I was told. Why was there still hidden risk? The answer is not that you were careless. The answer is that the body is more layered than most routine conversations allow. So let this not become fear. Let it become clearer understanding. Because understanding gives direction. It shows what to ask, what to watch, and what may still matter even when the report looks reassuring. That is the real value of this conversation. Not a miracle fruit, not a perfect number, a better framework. Heart disease after 60 is often driven by an ongoing process involving oxidation, inflammation, artery stiffness, foam cell buildup, weakened protection, and metabolic strain. Numbers can reflect part of that process, but not all of it. The goal is not only to improve a report, the goal is to support a healthier artery environment. That takes time, better questions, and a wider view. And that is exactly what older adults deserve. Thank you so much for watching Senior Health with Dr. Sarah Mitchell. If this video helped you understand your health in a clearer and more useful way, please like, subscribe, and turn on the bell so you do not miss our next videos. This video is for educational purposes only and does not replace medical advice, diagnosis, or treatment. Please speak with your doctor or qualified healthcare professional before making any changes to your medication, diet, supplements, or treatment routine. Please take care, stay safe, and may you have better health, more peace, more comfort, and more strength in the days ahead.